Hi there, I'm Molly Thomas, bringing you Aortic Hope's Week in Review here on our YouTube channel, AHTV. Thanks to Cook Medical and Edwards Life Sciences for bringing this week's Week in Review and their generous support and donations. If you'd like to read more about Cook Medical and Edwards Life Sciences, go to our main page and scroll down and you can read everything about all the wonderful things they do for aortic disease. All right, let's get started. It's a Movement for Movement Monday. The quote here this week is, "Progress isn't loud, it's the quiet choice to move anyway." Not every step needs a spotlight and not every win needs to be shared. Sometimes the real progress looks like choosing to get up when it's hard, taking the walk even if it's shorter than yesterday, and starting again without announcing it. It's the quiet choice to move anyway. Topic Tuesday is brought to you by one of our med students, Jack Nichols. And he says, "Good morning, Aortic Hope community. Today we're going back to the basics with the foundational topic, the anatomy of the aorta." A quick refresher, what is the aorta? It is the largest artery in your body. It carries blood with oxygen from your lungs and heart to every organ and tissue. Think of it as the main pipeline that branches off into smaller pipes to deliver blood everywhere it needs to go. Here's a great diagram of the aorta itself. The aorta has 3 layers. The wall of your aorta is not just one solid tube. It's made up of 3 distinct layers, each with its own job. Understanding these layers explain why certain aortic conditions develop. The inner layer is the intima, and it's the smooth lining on the inside of the aorta. Its job is to allow blood to flow easily without sticking or clotting. You can think of it like the smooth inside of a garden hose. The middle layer is the media. This is the thickest and strongest layer. It contains elastic fibers and smooth muscle that allow the aorta to stretch with each heartbeat and then bounce back. This is the muscle of the aorta, and it's what gives it its strength. The outer layer is the adventitia, and this is the tough outer covering that holds everything together. Think of it like as the protective casing of the aorta. All right, here's our layers right there in that diagram. And so why do these layers matter? When talking about aortic dissection, we're talking about a tear in the inner layer, the intima, that allows blood to push between the other 2 layers, separating them. This is why dissections are so dangerous. The wall is essentially splitting apart from within. When the layers weaken and the whole wall stretches outward, you get an aneurysm, which is a bulging area. And both conditions are very serious, but they happen for different reasons within the wall structure. The 4 sections of the aorta is the ascending aorta. It's the first section rising up from the heart. And it branches off into the coronary arteries, which feed the heart muscle. What is at risk here if there's a problem? The heart itself. A tear or rupture here can cause heart attack, valve leakage, or bleeding around the heart. The aortic arch. This is the curved section at the top where the aorta bends like a handle of a cane, and the arch gives off 3 major branches that supply blood to your brain and arms. What is at risk here is a problem. Blood flow to the brain, which is a stroke, into the arms. The descending thoracic aorta, it's after the arch. The aorta heads down through the chest, and this section gives off smaller branches to the chest wall, ribs, and spinal cord. What's at risk if there is a problem here? Blood flow to the spinal cord, which is a rare risk of paralysis and chest structures. The abdominal aorta. After passing through the diaphragm, the aorta continues down into the abdomen. This section gives off branches to the liver, stomach, intestines, kidneys, and eventually splits to supply the legs. What's at risk here if there's a problem? Blood flow to vital abdominal organs and the legs. When doctors talk about aortic dissections, they classify them based on where the tear is located, which we just reviewed. A type A dissection involves the ascending aorta, and it sometimes extends a little bit further. This is a true surgical emergency. Why? Because the ascending aorta is right next to the heart, and a tear here can cause severe leakage of the aortic valve, bleeding around the heart, which is called cardiac tamponade, a heart attack from coronary artery involvement, and a stroke if the tear extends into the arch. A type B dissection involves only the descending aorta, which is after the arch. While still very serious, these are often managed initially with medications to control blood pressure, rather than emergency surgery. Surgery may still be needed if there are complications, such as poor flow to the kidneys, intestines, or legs. Understanding this distinction is one of the reasons why imaging is so important, as knowing exactly where the problem is located guides every single treatment decision. The bottom line, your aorta is a remarkable structure, the 3 layers working together, the 4 sections that supply different vital organs. And when you read your imaging reports or hear your doctors discussing your condition, having this anatomy in mind can help you understand what is happening and why certain treatments are recommended. Have a great week. Think Aorta, says Jack. Thank you so much for that contribution, Jack. We really appreciate your efforts here. All right, going right into Wednesday, we have National Nurses Day. It is celebrating the power of nurses. We all have had them, and we all appreciate them very much. And I hope we remember every year to thank our nursing staff. They do such a great job tirelessly. All right, we have the Aortic Disease, the Patient Guide survey. So if you have received or read the Aortic Disease, the Patient Guide, we encourage you to do a survey so that we can better, with all the subsequent patient guides coming through, we can do a better job at it with your input. So please don't forget to fill out the survey. And at the end of each month, we will give away a random drawing of a $30 Hope Shop certificate. All right, and we have our Survivor Series and Where Are They Now, which is following up on those who have provided their Survivor Series story. And we'd like to see where they are now. So if you haven't done so, please check it out and sign up, and I'll get the email and we'll get you sorted out to tell your story. So please do so. The community lives for it. We really enjoy these Survivor stories. So here we have Ace Your Healthcare Journey. Advocate. It's a two-way street for success. It's between the patient and the doctor. You advocate for yourself, you communicate with your doctor, and you educate yourself on your particular disease. And we wrapped up the week with Qigong. We have Kevin Songer coming back for his second season, and he's really great. If you haven't checked out the Qigong series, please do so. It's similar to Tai Chi, but it's just really, it's a great way to start your day. He starts Sundays at noon Eastern time, and it's calm, mindful movement, and it's a space to restore and reconnect. As always, check with your physician first before starting any new exercise program. All right, we are wrapping up this week in review with our events page. And what we have coming up for you is, all right, well, tonight at 7 p.m. Eastern time, we have The Aortic Artist with Diane Bishop here on our YouTube channel, AHTV. And by the way, if you haven't done so, click that notification bell and you will be notified anytime Aortic Hope drops some new programming, like tonight with Diane Bishop. And then tomorrow we have at 10 p.m. Eastern time, we have a support group meeting. Wednesday, we have the Caregiver Connection. And Thursday, special guest, Dr. Ben Udelman. He's a fan favorite here at Aortic Hope, and he will be participating in the Q&A. So we encourage you to write any questions you have for the doctor, and he'll answer them right then and there. Great. And Thursday, the 14th at 7 p.m., we have the bereavement group meeting. And Sunday, the Aortic Kitchen with Rob Seltzer, and the topic is 3 and 4 desserts that are very low in sugar. That should be very special. Thank you so much, Rob, for bringing your talents here to Aortic Hope. All right, thank you again very much for joining, and don't forget to like and subscribe. And again, another big shout out to Cook Medical and Edwards Life Sciences for making this Week in Review happen. Thank you so much, and have a great day.